Is this thing on?
I am Queens.
Hi, everyone. My name is Alyssa, and you are listening to the All Things Pelvic podcast, where you get to follow my life as a pelvic floor physical therapist. That may sound a little boring, but real quick, let me break it down. I bring up topics that most people find difficult to talk about, but maybe it's time we get comfortable with discussing the uncomfortable. I always strive for real talk, good vibes, and mostly all things pelvic. Join me and my guests as we discuss healthcare, culture, and real life topics. Are you ready? Because it's time to take a page out of my playbook. Hi everyone, my name is Alyssa, as most of us know, and welcome back to All Things Pelvic. You heard me talk about the issues in healthcare, especially within the US, and as we all know, I have no problem complaining about the many issues that there are. And today, you may recognize the guest that I have on here if you follow my Instagram account. A few weeks back, I had a very brave mother share her story about her pregnancy journey, and she's here today. And I'm going to let her introduce herself. Deanna.
Hi everyone, my name is Deanna. I'm a mom of two. I'm a business owner, owner of Alluring Decors and Delicacies. And yeah, I'm just here today to talk to Alyssa about my story and my experience with the healthcare system and having my child.
Oh, yeah. And, I was actually just telling Deanna too, I think anybody who has dealt with the healthcare system in general, especially within the US, I mean, I think there are issues obviously all over. We can definitely talk about that, but there's been a lot of things that have been brought up, I feel like, especially on social media lately too. I think social media is definitely a blessing and a curse at the same time,
Right.
where we kind of realize that there's so many issues, but then also you might have the mom saying, especially maybe after they read your post, saying, wait, that I went through that too. So I also
Mhm.
feel like it's kind of a blessing in a sense where you can say, I thought that was just me, and I didn't realize that there were other people going through this too. But
Right.
I
It just shows that you're not alone.
oh, totally. And I think that
Mhm.
that is kind of the blessing of social media, that you
Right.
aren't alone in this. I think I say that on like most of my posts that I that I like start to post on my account. I'm just like, yeah, it's not just you. I actually say that to patients pretty much every day too. Like that a lot of
Yeah.
them come in and they're like, am I the only, like, especially my postpartum moms, they're like, am I the only one with this? And I'm like,
No.
no. Not at all. Not at all. But this is all you, hun. Share your story. Go for it.
So on December 8th, 2019, I had my second child. It was already considered a high-risk pregnancy after having my first daughter. Um, just a long story short with her, when I had her, she came out not breathing. She was choked by the umbilical cord as I was pushing. So I had to have an emergency C-section. So just due to that, my second pregnancy was already considered high risk. So they had to keep an eye on me. Um, Throughout my pregnancy, I just was going through a lot of different things. I don't know if I would consider them complications, but just having a lot of issues with contractions, with a lot of pain, just several things that forced me to go to like ER a lot. And so toward the end of my pregnancy, um, I had really high blood pressure. I had a doctor's appointment, and when my blood pressure was checked, my doctor was like really alarmed. And they're like, you know what, you need to go to labor and delivery. Like, and they're probably going to induce you today.
Yeah.
And so I'm like, okay. So I'm freaking out at this point, but I'm like trying to remain calm. I go to labor and delivery, and literally they just monitor me for an hour and send me home. They tell me, oh, you're fine. Like, go home. You're okay.
That's
And I'm
wild.
like, I thought it was strange, like, because I just felt like I wasn't being cared for like that. And even prior to this specific incident, like I said, I had been going through a lot throughout my pregnancy. And so always having to go to the doctor and just feeling like they're kind of brushing me off, like, oh, we'll monitor you for a little bit. You can go home. You're okay. This
Which
is
is
normal.
like, which always kind of kills me a bit because it's like I'm sorry, honey, I didn't mean to cut you off. It's just like,
No,
because I get so mad. I get so
right?
mad over these things because if you already were known to have complications, right? You're already
Right.
known to have those things.
sometimes you are fine for an hour. You are fine for 2
Right.
hours, so like
Right.
why not at least keep you overnight?
Right. Right. And that was my issue. And my mom, too. My mom works in the healthcare system. So she's like, no, you should have stayed there. They honestly should have induced you. Your blood pressure being high, in addition to everything else that has been going on, like, you should have been induced. And I'm like, yeah. So once sending me home, well, before sending me home, when they discharged me, they told me that I would have to take NST testing or come to NST testing up until my pregnancy. So I'd be seen twice a week. So I did one NST testing, and after that, that was it. Literally during my NST test, let's talk about that. So
yeah, I was gonna say explain what it is and stuff. Yeah, just so everybody knows.
So it's basically just when your baby's heart rate is monitored. They kind of keep an eye on you for like, I believe it's an hour if I'm not mistaken.
Yeah,
I can't remember the time frame exactly, but yeah, they keep an eye on your baby, like her heart rate, just to make sure everything is okay up until your delivery time. And so on my first appointment, the nurse who was monitoring my baby, she kept saying, there's a lot of amniotic fluid. Like, she just kept saying it. So after a while, I'm like, well, is that a bad thing? Like, and she's like, well, it can be, but you should be okay because it's only on your left side. And so I'm like, I should be okay. Like, that kind of sunk in for me. And I'm like, I don't really feel comfortable, but, being that she's in the medical field, she's a nurse, she knows what she's talking about. Mind you, she was a Black woman like myself.
Mm-hmm. Yeah.
So
you had to trust in her, like, automatically.
Right.
Yeah, of course.
Right. Yeah.
Of course.
So the following day after I leave, I noticed that I didn't feel movement anymore in my baby. And my baby was very, very active, like moving constantly throughout the day. And so I was telling my mom and my boyfriend, like, I don't feel her moving anymore. And they're like, no, like, I think you're fine. Like, you should be okay. Maybe you're just overthinking. And so literally the next day after that, like, I was having so much pain, like lower abdomen pain. And again, I still didn't feel her move. So by this time, it had been 2 days. I'm on my second day of not feeling movement. So I'm like, I'm going to the doctor. So I go to the doctor and I find out that she no longer has a heartbeat. And so it just got kind of like, I just couldn't believe it. I just was just in complete shock. And then it started making me wonder, like, was there something that I did wrong? Or like, should I have like been more persistent as far as like how I felt when I felt like they were just like disregarding me and kind of, telling me you're fine, you can go home. Even with the NST testing, with her telling me you should be okay. What do you mean should? Like, we need to figure out, what's going on,
Right.
And so it started kind of making me question myself as far as like, could I have done something to make things go different? But eventually I realized like, no, I trust the medical field and, I did my best.
Of course.
And so moving forward, I think I would handle it a lot different. Trust my gut.
Yeah. Yeah. I mean,
definitely.
First of all, I just remember first hearing your story and I can't even imagine,
Right.
I can't even imagine, but you did, just like you said, you did the best you could. And that's all you can do. That's all you can do because at the end of the day, you do have to move forward, right? And then that's, again, all you can do. But when you do look back at these certain things, now you also know, and I know we've talked about this too, and you wrote this in, in the Instagram posts that you would handle things differently now, and
Definitely.
kind of like trust your gut a little bit more. I think I say that most days. Like, even if you don't know what something is, if you feel that something is off, then just at least try and do something about it.
Right.
Even that she was a nurse was the one who said that. Yeah.
Yes.
So even to her, even on her end, as a healthcare provider, right? As a healthcare provider, I know that we're human too.
Right.
We are human too. So at the end of the day, sometimes we are just trying to get through our day. However, I always dial back sometimes and I'm just like, sure, am I getting out at like 7:30 and I'm ready to like go home and do what I need to do. But at the end of the day, that person coming into me is coming in for help as well. So always explain everything as if they do not know anything that's going on, at anything at all. So her saying, kind of to like, oh, you should be okay. It's explain to me possibly what's not. And then,
Right.
yeah, and then also, what is okay with this? Like,
Right.
why is the the amniotic fluid, why is it fine for it to be there right now? Like, is there a reason why
Right.
that's okay? So I feel like, on her end, she just should have like explained a little bit more, instead of,
Mm-hmm.
I personally would rather somebody explain to me why something is going to be wrong than the sugar coating. Don't try to make
Right.
me feel better right now if
Right.
like I'm not okay. If I'm
Right.
not fine right now. Granted, you also could have been fine right in that specific moment. Right? Like in that
Mm-hmm.
but her just saying like you should be, it goes back to the importance of like wording and stuff
Right.
too. Like what do you mean should be? Am I
Right.
not? Um and then even just you feel it, you obviously had that intuition. You had that
Mm-hmm.
intuition that something was off, especially when you didn't feel her moving. So,
Right.
yeah, and even with that, that does happen. That does happen sometimes where the babies just
Mm-hmm.
aren't like as active, they aren't as active. So I can't blame your mom and your boyfriend for saying, like, oh, like I'm sure it's okay. I'm sure it's okay. So
Mm-hmm.
yeah. So, okay. Let's dial back. Let's dial back a little bit. And
Okay.
if you're, if you're okay, if you're comfortable talking about this too. Now, the
Mm-hmm.
aftermath of everything. Um, I'm sure there was probably like a mix of emotions here.
Definitely.
Yeah. So talk
Definitely.
to me about that, hun. Like how did you feel kind of afterwards, and like what I know now though too, you kind of advocate for anybody, going through this. So how did it kind of lead you into that? How did it lead you into that?
Well, from the beginning, it was an emotional time for me.
Yeah.
Like just knowing, like even after having her, knowing that I had to leave the hospital with no baby, like it was
Yeah.
just, it was unreal. Even the first time, during my first pregnancy, I had to leave my baby without, leave the hospital without my baby. So, because Demi, my first daughter,
Yeah.
she was in the hospital for about 3 weeks. She was in the queue before we could take her home because when she was born too, she swallowed amniotic fluid. And so they had to get it out of her lungs and, just kind of monitor and make sure she was okay before sending her home. So to go through it a second time and know that, like, I'll never be bringing her home. Like, it's not like, oh, we can go back and get her, just like we did with Demi. It was just unreal. And so also during my pregnancy, I had I wouldn't say a friend, but an associate that I went to school with.
Mm-hmm.
And she actually lost her baby. And so like at that point, I was like 6 months pregnant. And I'm just like, wow, I couldn't imagine. So fast forward to what happened to me, I'm just like, wow. Like, you hear about these horror stories and you hear about how Black people or Black women are unseen in the healthcare field. And, we're known to be invisible, as some people say.
Yeah.
And you don't really see it until it happens to you, honestly. Like, you're like, yeah, you understand. But I think it doesn't hit you until you're in that situation or until you know someone in that situation. You know what I mean? So once I had my baby and then I knew that, there was someone who had gone through my situation, I wanted to be that bridge for people to feel like, I am heard and, I'm not in this alone. Right. So that led me to wanting to become a doula, just to be there for other women. And so right now I'm taking my courses from Birthing Advocacy and I'm in training to become a doula. Yeah. And so I just want to, like I said, just to be that bridge for women to feel like they're heard and that, someone's there listening to them, to whatever their needs are throughout the pregnancy process, after having their child, and, just right. that's my goal, to just be there to support.
Right. And I think that that's probably one of the best things that you are now taking this and turning it into a positive light now for other women, too. And I think that's amazing. And especially, and I know you have a focus on Black women, correct? And women of color. Okay. Yeah. And first of all, that is amazing in itself, too. And so I'm not gonna lie to you. There were times, I would say, even if like you asked me like a few years ago, and it's because I don't treat anybody different as like a healthcare provider, like I don't, but that was like very naive of me to think that, like very, very naive, because at the end of the day, people really are treated differently because of either where they're from, their skin color. And I have had experiences like that firsthand with people like saying stuff on the street to me, you know, about like my skin color or whatever it is. And I'm pretty much a positive person overall. So I'll just be like, oh, like something was wrong with them. Or like I'll even like
Right.
I'll kind of give them the benefit of the doubt when like that's not okay. That's not okay at all.
Hmm.
And then just like you said, you need to go through something firsthand for you to actually say like, oh, no, something's wrong. So
Right.
a few years back, I was kind of gaining weight like pretty quickly. It was weird. Like I do have like a hormonal like issue that I've had since I was younger, but it was weird. It was like 12 pounds within like 2 or 3 weeks. Like that's a lot. Right. Like that's a lot. It was just really weird, and like my eating wasn't different. So I go to this doctor, and they were like, what's your background? I was like, oh, well, you know, like my mom is from Trinidad, my dad's from Guyana, so like Caribbean background overall. And they were like, oh, diet, you need a diet. And like before they were just like, diabetes definitely runs in your family. Like kind of just like, yeah, your face right now. Right. And I know that that's a common thing in Caribbean culture and stuff, but I was like, hold up, like you didn't check my blood. You didn't, yeah, you didn't even ask me. Like I used to be like pretty big, you know, like I used to be like very overweight and stuff, and I did lose a lot of weight. So like you didn't even now ask me all of the things to like try to figure out what's going on with me. You are just assuming that I'm at home eating roti and curry, and like that's
Right.
it. You know, like that's like your assumption of me right now. So it like, and that really bothered me too. And it was a he, which is, yeah, enough in itself. I feel bad.
Right.
I know, I feel bad saying that because like all my male patients, I love you, but it like, there's a difference. Like I personally do,
Yeah.
I would rather go to like a female doctor. That's a whole podcast episode in itself.
Right.
But I was kind of just like, what? Like
Right.
you are writing me off
It's
right
unbelievable.
now. And that, yeah. And now I'm not Black. I'm not. So like that's what happened there. I can't even imagine now, like what happens, you know, within the Black population a lot. One of my friends was telling me something the other day about how somebody just wrote her off right away for just kind of same deal with like being Caribbean and stuff. And she was just like, she wasn't even trying to understand like what I was there for. And it,
Mm-hmm.
yeah. So I love that you have a focus on that too, because like the more that I'm in it and the more that I do treat, the more that I see it. The more that I see it. And the more that I hear it now too,
Mm-hmm.
you know, when somebody comes in, they're just like, I feel like nobody was listening to me. They keep on blaming stuff on like my ethnic background and all this stuff. And that is a very big thing. And listen, there is research that like Caribbean culture, certain people of color, the Black population, like there are a lot of like diseases that go, and same thing with the white population. Like there are a lot of diseases that go along with a certain ethnic background, but there are obviously certain cultures that are looked at differently and certain backgrounds that are looked at differently than others. So I love that you're kind of taking this and running with it and trying to advocate for those populations that aren't. So that's what I'm all about. That's what I am all about. So I love that. Now, on your end, do you think for you that this is like kind of just part of your healing process too?
I do. I think because I'm a very spiritual person, so I think everything happens for a reason, and I think that this had to happen for me to grow, and for me to be in the situation or the space that I'm in now, to where I can advocate for other women, that I can be that support system for other women, that I can tell my story so that women can understand, like, look, I'm not alone. And yeah, we hear it, but, I have this direct representation that can show me, and someone that can tell me, look, I've dealt with this too, and I'm still growing and I'm still healing, And so just to be able to share, I do think that this is something that happened for a reason,
Yeah.
to allow my healing, for sure.
I love that. I love that. And I think like channeling that energy to help other people too, like that is going to be something that when you do finish your courses and when you start and when you start and everything, like you'll see, it's very rewarding when you can help somebody, and help somebody through that process and everything too. I'm obsessed with doulas. I really do, like, I love doulas so much, and I think there's always something to learn too. Like, I thought I knew everything there was to know, and I did a podcast episode with somebody that I met from a friend, like a mutual friend, and she's a doula, she's a birthing doula, and I didn't know there was a difference between like a birthing doula and a postpartum doula. I had no idea. I thought that they were just doulas, right? Like I just like thought they were doulas, and then I was just like staring at her as we were recording, and I was like, you really do learn something new every day. You like truly learn something new every day. I really didn't know, but I'm of course like I'm all about learning through that. But I think it's such a good thing for people to have, and it's something that's actually becoming more common now too, is people having doulas and just like knowing about them, along with like having a midwife, a pelvic floor PT, like all this, a whole collection of people. And I think it's so important for women to know that. So I actually work very closely with a doula who is very well known. She's very, very well known. And she raises money for Black women to go to pelvic floor PT and to do all these different things. Like that is what she does. She is an amazing human being. Absolutely amazing. And that's literally what she does. Like she just like fundraises and advocates for Black women. And I thought that was one of the best. I was just like, I'm in awe of you. Like I'm in actual awe of you for doing that. But unfortunately, she was telling me, and I've actually talked about this on a podcast before too, but there's a difference with ethnicities too, just location. And unfortunately, like financial, if like like finances and everything too. So, she was saying that with people of color being at the bottom of the barrel for so long, they're also kind of the last to find out that there are like all of these resources and all of these things that like you could be doing because of that too. And now for you as well, do you think that may have been part of the issue for you? Is that like you didn't have enough resources to like, people telling you like, you can go do this, like you can go do that, like in your, like just within your healthcare experience?
No, not necessarily. Not really so much the resource thing. I think just more so asking more questions for me.
Yeah, for sure.
Like, and like why, like why is this not okay? Like you said, like you mentioned, just being more open to asking why things are the way they are. Like why is this okay or why is it not okay? I think more as opposed to the resources.
Yeah, for sure. And then even just to backtrack with even what I said, like I have a lot of friends who are like honestly like on the richer side, too. They're like on the richer side, and like they felt like they didn't have resources when they were pregnant and stuff too. So I feel like it definitely goes both ways. Like, and just pretty much what I'm trying to say is we just need more resources in general. It doesn't matter what your background is. We just need like more advocacy and like resources just for people to know about things too. But so what you just said, okay. I tell patients all the time, if you need a second opinion on something, like please do. Like please go ahead. Even if it's a second opinion from me. Like if you don't think what I'm telling you is like what you would like to be hearing, first of all, or even just you don't think that what I'm doing even like is helpful for you, and most of the times like I am very like I'm pretty thorough with my patients, and like I will explain what I'm doing and why it's good or why it might be bad potentially too, and go from there. But I say it all the time. I'm like, we in general just need to advocate for ourselves way more.
I
Way
agree.
more. It's okay to question, a professional. It's
Right.
okay to do that. And there's also a way to do that without stepping on a professional's toes too.
Right.
You don't have to say like, "What are you doing? Why are you doing this?" And like you don't have to be rude about it, but just say like like is there like why are you doing this? Like is there a reason? Is there, and there's a way to say it. And I
Right.
think also I can't blame you for just listening to what the nurse said. At the end of the day, you were
Right.
going to a healthcare professional. Like you were
Right.
going to a healthcare professional, and that is what she told you. That's what she
Mm-hmm.
told you. And a lot of patients and a lot of just people in general, like a doctor tells them something, okay. Like that's what they need to be doing. That's what they need to be
Right.
doing, and like that's okay. But sometimes it's also not. Like if I've had plenty of patients kind of come to me and say, like I just kind of like looked you up and I just wanted to see because my doctor told me that I needed to get surgery. And then a lot of the times in my head I'm kind of like, I honestly don't think you need surgery. And then if I
Right.
if I really do think that, I'll tell my patients, I'll be like, you know what? Like, why don't we just try this first and then see how it goes. And then I'll even call the doctor too and be like, listen, like they're getting better in PT, is there any other option for them? Because I think sometimes like that first line of medicine, surgery, people want to do that right away. So like you said, just like advocate for yourself first, like do some research, and that I think is super important.
Definitely.
Yeah.
Definitely.
Yeah.
And then even going back with the NICU nurse, like literally after I had my baby, I don't know if how she heard or what, but she clearly knew that I had her, and she seemed heartbroken. Like she came in, like literally hugged me for like 20 minutes.
Yeah.
That was it. She didn't say a word. She
Yeah.
just came in and she hugged me. So I'm just like, I wonder what she was thinking. And I wish I could have had more context with her. But, during that time, it just wasn't the time for me.
Of
So I didn't talk to
course.
her or anything. But like looking back, I'm like, I wish I would have talked to her, or that I had the opportunity to have a conversation with her after everything, just to kind of see
And
what she was going through or what was going in her head.
right, right. Especially since she came in and there was silence for that
Right.
amount of time. That's a long time. Like
A
even
long time.
even a few minutes is a long time to just like be in
Right.
silence like that.
Yeah.
Well, what would you want to talk to her about? Like what would you say?
Um, like one, just wanting to know, like, um, like what made her come and hug me, of course, obviously
Yeah.
because of the situation, but like she obviously felt the need to come and hug me for a long time. You know what I mean? Like, obviously I lost my child's comfort. Yes. But I think her knowing like, you just saw me. And so, like I just helped you. So it's just like, like, is there something that you maybe like wanted to tell me, or,
Yeah.
just, I don't know. I don't know how that conversation would go, but just being open to have a conversation with her.
Sure. And I mean, I think that says a lot about you as a person
Mm-hmm.
too, clearly like empath, like wanting to like
Right.
figure out like were you, how did you feel kind of about that? It goes back to my statement of like us being human too, like healthcare
Right.
professionals. Uh, and especially it's weird though. It's kind of like a paradox, like you were upset that she kind of said, "Oh, you should be fine," but then you also
Right.
felt kind of sympathy towards her, when
Definitely.
she came in and when she hugged you. And
Yeah.
I know in the post that you wrote for me, in your story too, you specifically said also you felt a way because she's also a Black woman.
Right. Yeah.
Yeah. Um, yeah. I have I don't know what to say with that.
Right.
Yeah, I think there's like a lot of thoughts that are going through my head with that. Do you think that, and I know it's kind of a hard question to answer, but do you think that maybe you would have thought differently if it wasn't a woman of color that was taking care of you?
Yeah, because I too feel like I know obviously like how we're treated, Black women or people of color, but also being in situations where I feel like I'm not heard by women who can't relate to me because they're not Black. So I think that in that instance, I would kind of be like, it's kind of expected.
Right.
But being that it's someone who looks like me and knows the struggles that we as Black women go through, I'm just curious as to why she didn't like look further, or like there is a lot of amniotic fluid on this side. Let's try to see what's going on, or maybe we should keep you, or maybe we should take you to labor and delivery. You know what I mean? Like just offer more options to me and be more understanding. It just shocked me that she wasn't, just being a woman of color, like and someone who looked like me.
1000%. And I know you'll kind of never know this, of like specifically what's going through her head and everything, but maybe it was. Like maybe that was what was going through her head and stuff too. I know on a personal level, when somebody comes to me with the same like cultural background and stuff too, and it's not to say that I take care of my patients differently at all, because like that's not the case, but sometimes I will have somebody who is from the same backgrounds, like they'll disclose a bit more to me because of that, because there is that understanding of course. And I think that's even just like how women empower women. We're all women at the end of the day, but then of course you then have the other layers that go into it too. Oh, you're from Trinidad and Guyana also? Okay, let's talk about that background. And then I think there's always those other layers. So at the end of the day, she could have kind of been thinking that as well. But yeah. Okay. With that being said, I want to thank you for being on here and telling your story again. And I think I'm kind of like, my brain's kind of like reeling right now, just because like I even just learned a lot from what you were just telling me, just like it, and kind of learning more about your story is that like, I think what we can take away from this is that resources need to be out there more, which is something that I talk about all the time. But then also your healing process is one of the most important things. And you are now channeling it into helping other people further, which I think is so amazing. I can't wait to add you to my resource list when you are like fully a doula. I can't wait. When will you be done with everything? When will you be like all completed with like the courses and stuff?
Well, I have it up until next year, February, but I'm hoping to finish well before then. I'm almost like halfway through the course, so.
Yay!
Yeah.
Oh, amazing. And you're going to be amazing at it. You're going to be amazing. Yeah, of course. Well, because then you are now going to have that connection with your clients too, with, you have been, you've had your baby and everything, you've been pregnant, so you'll be able to, kind of just help them through that. And I think that's an amazing thing too.
Right. Thank you for having me, Lisa. I appreciate it so much.
Of course. Yeah, and I'm ready to have you on here again, of course. Of course. We can talk about more doula things in the next one. Or, no, wait, what did we talk about before where I was like, that could be, men versus women doctors.
Yes.
Definitely down to talk about that. But where can people find you? Where can people find you if they want to contact you, maybe share their story too?
So you can find me on Instagram at Demi's Mommy. So it's DEMYSMAMI.
Yeah. Perfect. Thank you so much for being on here and for sharing your story.
Thank you for having me. I appreciate it.
Thank you guys so much for listening to the All Things Pelvic Pod. Have questions, concerns, comments? Want to share your story? Remember to follow me on Instagram at _pelvic floor playbook. DM me, share my stuff, like it, and let me know what you think. As a reminder, this is not medical advice by any means, so don't be out here doing a bunch of nonsense in these streets. If you need me and want a vibe, you know where to find me. I'm out.